Welcome to the Cenario podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Okay, let's dive in. When you think about mental illness, what comes to mind first? Is it purely medical, like a virus, something biologically concrete?
Or maybe something, well, more complex, shaped by our lives, our stories, maybe even society itself.
Exactly. That's the tension we're exploring today. This whole debate between neuroscience, the brain science view, and the narrative view, the power of personal experience.
It's a fascinating area, and it really pushes us to think. A lot of this conversation goes back to Dr. Thomas Szasz in his book, The Myth of Mental Illness.
Ah, yes. A pretty controversial title.
Definitely. His core idea, and it was radical then, still resonates now, was that many conditions we label mental illness aren't really diseases in the same way, say, pneumonia is, not with clear biological causes you can point to.
He saw them more as problems in living, challenges.
Problems in living, that's right. He wasn't saying the suffering wasn't real, that's crucial, but he heavily questioned labeling it a disease automatically, especially without solid biological proof.
Which brings us to now. Decades later, we've got fMRI scans, we know so much more about brain chemistry, neurotransmitters, all that.
Right. Huge advancements.
So the big question is, has neuroscience actually definitively proven that mental illness is a biological disease? Or is there still this massive role for, the story, the context?
That's the core of our deep dive today. We're not aiming to settle it definitively.
No, probably couldn't anyway.
Probably not. But we want to explore the arguments, look at the science, look at the experiences. Where do they overlap? Where do they fundamentally clash? Understanding that tension is key to understanding mental health today.
Okay, let's really dig into Szasz first. Beyond that provocative title, what was the substance of his critique?
Well, a central pillar was this lack of objective biological markers. There isn't a blood test for schizophrenia or a definitive brain scan for depression, not in the way we diagnose, say, diabetes or a broken bone.
It's not like you can just look under the microscope and see it.
Precisely. He pointed to things like the DSM, the Diagnostic and Statistical Manual. He argued its classifications are based mostly on descriptions of behavior, on subjective reports from patients.
So it's more like a checklist of symptoms that tend to cluster together.
Exactly. A consensus about symptoms, not the detection of a specific underlying biological fault. And because of this lack of objective markers, he was really concerned.
Concerned about what specifically?
He worried that psychiatric labels, and especially things like involuntary treatment, could become tools for social control, for managing people whose behavior deviates from the norm.
Pathologizing difference, essentially.
That was his fear. Medicalizing distress that might be a perfectly understandable reaction to, well, terrible life circumstances. But again, it's so important to stress he wasn't denying the suffering. He was challenging the framework. Is calling it a disease always the best way?
That's a critical distinction. Okay, let's switch gears. Neuroscience. It's a huge part of the modern biopsychosocial model. What's the evidence it brings to the table?
Neuroscience has definitely found biological links or correlates. We have brain imaging studies, fMRI, and others showing differences in brain structure or activity patterns in people diagnosed with conditions like PTSD, major depression, schizophrenia, compared to control groups.
So observable differences in the brain.
Observable differences, yes. And then there are the neurotransmitter models, the theories about imbalances in chemicals like serotonin or dopamine affecting mood, which is maybe more complex and often portrayed, but yes, that's part of it. And also genetics research showing that some conditions like bipolar disorder or autism spectrum disorder have clear heritable components, patterns run in families.
Okay, that sounds pretty compelling. Biological differences, chemical links, genetic predispositions. But you mentioned caveats earlier. What are the limitations here? Where does the neuroscience picture get, well, fuzzy?
This is really where it gets tricky. Despite all these findings, the big one is, we still don't have a single definitive biological test, a biomarker for any major mental health disorder.
Right. No blood test for anxiety, no brain scan for bipolar.
Not one that gives a definitive diagnosis on its own, no. And another major point.
Yeah.
Those brain differences we see, they might be the result of psychological distress, not the cause.
Ah, the correlation versus causation problem.
Exactly. Think about chronic stress or severe trauma. We know those experiences can physically change the brain over time. So are the brain differences causing the condition? Or is the condition or the experiences leading to it causing the brain differences?
Right. It's hard to untangle.
And then add in neuroplasticity. The brain is constantly changing, adapting to experience. That makes it incredibly hard to pin down whether a difference is the starting point or an outcome. Trauma is a huge factor here, as we said. Even just life experience shapes our brains.
So neuroscience gives us clues, important clues about biological factors, influences, but not necessarily the whole story or clear-cut causes yet?
That seems to be a fair summary, yes. It points to biological vulnerabilities and mechanisms, but the full picture is usually more complex.
Which leads us neatly into the narrative approach. If biology isn't the complete explanation, what does focusing on stories, on context, add?
Well, the narrative approach, which is really central in things like narrative medicine, shifts the lens. Instead of asking only what's wrong biologically, it asks what has happened to this person.
Okay.
It focuses on the meaning they make of their experiences, their identity, their relationships, the social world they live in. It acknowledges that for mental health struggles, our personal stories and our environment can be incredibly powerful shapers of our reality. Sometimes maybe even more so than biochemistry alone.
So it's about the why behind the what, understanding the person's whole journey.
In large part, yes. It pushes us to consider things like, what does this suffering mean to the individual? What role do social factors play? Things like poverty, racism, violence, isolation. These have profound impacts that a purely biological model might miss.
And it opens up different ideas about healing too, right? Not just fixing a chemical imbalance.
Absolutely. It suggests that healing might involve finding meaning, changing circumstances, building connections, perhaps even without needing a formal diagnostic label, though labels can be helpful for some people too.
The source mentioned examples like cultural psychiatry.
Yes, that's a great example. It shows how what counts as illness and how it shows up can vary hugely across cultures. A vision might be psychosis here, but a spiritual experience elsewhere.
And trauma-informed care.
Also key. That approach sees many symptoms not as pathology, but as understandable, even adaptive responses to overwhelming experiences. It shifts the focus from what's wrong with you to what happened to you.
And you also have things like anti-psychiatry or survivor movements.
Right, which often critique over-medicalization and push for more choice and less coercion in treatment, emphasizing the person's own narrative and rights.
Okay, so we have these two powerful perspectives, the biological and the narrative. They seem quite different. How do we sort of reconcile them? Is Szasz right? Is it all a myth, or is it purely biological?
Well, the lived reality is that mental suffering is incredibly real. Deep depression, terrifying psychosis, crippling anxiety. The pain is undeniable and warrants empathy and effective support. That's the starting point.
Of course.
How we understand and address that suffering, though, that's where culture, science, and history all come into play. It seems the most helpful approach needs to be holistic.
Meaning we need both.
I think so. We need neuroscience to help uncover biological vulnerabilities and how our bodies and brains are involved. But we absolutely need narrative frameworks to honor the person's unique story, their meaning-making, and the social context. And we need ethical analysis, too.
So even if mental illness isn't exactly like, say, a broken leg with a clear physical cause and effect,
the suffering is just as real. It might operate differently, involve different layers of cause and experience, but the need for care and understanding is paramount.
And why does getting this balance right matter so much, practically speaking? What are the real-world consequences of this debate?
Oh, they're huge. It affects treatment decisions every day. Is medication the first line, or is therapy, or addressing social issues like housing or poverty? Big question.
Right.
It impacts stigma, too. If it's purely medical, does that reduce blame, but maybe create other forms of stigma? If it's seen as a problem in living, does that empower people or risk minimizing severe conditions? It's complicated.
And policy. Things like hospital admission, legal issues.
Absolutely. Involuntary treatment laws, how the justice system handles mental health crises, disability benefits, our underlying model of mental illness shapes all of this. And perhaps most personally, it affects identity. Do you define yourself by your diagnosis? Or by your story, your resilience, your life beyond the label?
It really gets to the heart of how we see ourselves and each other.
It does. And thinking back to Szasz, his work wasn't just a critique, it was really a call to question assumptions. Is medicalizing all distress always the path to healing? It forces us to think.
So wrapping this up, it sounds like neither side has the complete monopoly on truth here.
That seems right. Neuroscience gives us invaluable pieces of the puzzle, understanding biological mechanisms, potential treatments. but it doesn't capture the whole experience.
And narrative gives us meaning, context, the human element, but maybe not always immediate practical solutions for acute distress.
Exactly. Finding the right balance, integrating the data with dignity, the symptoms with the stories, that feels like the challenge and the necessity for truly understanding mental health now.
That leaves us with a lot to chew on. And for you listening, maybe think about this. How do these different views, the biological, the personal story, the societal pressures, influence how you think about mental well-being? Your own, or that of people you know, are current ways of understanding and helping really capturing the full, complex human experience. Something to definitely keep thinking about.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.